Well, I'm back. I'm Dr. David Beaulieu with more news you can use. And how about a little fun today? Let's start off by talking about Alzheimer's disease and the possibility that Alzheimer's just might save this nation from Alzheimer's. By the way, now the number 3 killer in our nation, cancer, the number 2 killer, and heart disease. Oh my goodness, how could Alzheimer's possibly save us from the top 3 dreaded killers? You know, it may not be all that difficult. It may also save us from diabetes. Number 2, diabetics, overweight, huge problem in this country. Alzheimer's might be the answer. You know, an estimated 5.4 million Americans have Alzheimer's disease. 5.4 million. And that's a lot of people. The most recent data suggests that well over 500,000 Americans die from Alzheimer's disease each year, making it the 3rd leading cause of death in the United States, right behind heart disease and cancer. Losing your mind and with it much of your personality and dignity is a terrifying proposition. Believe me, I'm terrified of it, and if you're not, you need to rethink it. Making matters worse, many doctors, myself included, shy away from addressing dementia. I do not do that. I am not afraid of talking about dementia. We're going to do it in a number of these little pieces called News You Can Use. Alzheimer's strikes at the emotional heart of many clinicians whose careers depend on the stability and functioning of their own minds and intelligence. In short, it frightens them too much to talk about it, and I can really relate to that. There is no standard treatment that offers hope for Alzheimer's disease. None. None. While early diagnostic tests are in short supply and successful treatments are virtually non-existent, the evidence shows there's plenty of hope when it comes to prevention. This is exactly why doctors need to get with the program and start directing their patients towards healthier lifestyles rather than fall into the trap of thinking the situation is hopeless and their patients are helpless victims. Well, how do we do this? How do we do this? It's interesting. High-fat diets, low-sugar diets. Exactly what the opposite, 180 degrees opposite of what's been recommended by the United States government and all of our medical expert authorities over the last 40 years. The brain is over 60% fat by weight. You cannot follow recommendations and reduce your fat intake to 10% of your caloric intake and expect to have a healthy brain, especially when you get a new brain as an adult approximately every 24 months. It turns out the brain isn't static. It's amazingly neuroplastic. It replaces itself every 2 years with genuine replacement parts. What's the number 1 genuine replacement part for the brain? Healthy fat. It's very important. I talk often with my patients about apparent essential fatty acids, linolenic and linoleic. If you get those essentials, your body makes all of the omega-3s, all of the omega-6s, all of the omega-7s, all of the omega-9s, all of the unessential fatty acids that people take in huge amounts, like fish oil, for example. If you get the parent essential fatty acids, your body makes all that. It's nice to get those from an organic plant base. We've got that in parent essential fatty acids. There's been a lot of research done in this area. When people start treating dementia, Alzheimer's dementia from a preventive standpoint, guess what other diseases respond? Cancer responds. The risk drops tremendously. heart disease. We've got treatments for these conditions, including diabetes. As long as you go to the doctor and you can be treated for a disease, we don't worry about preventing it. If we prevent it, we don't make any money. If we treat you for the disease, we make a lot of money and you're happy. But we have nothing for Alzheimer's. So if you get on the proper preventive approach to Alzheimer's, a high-fat, low-sugar, virtually ketogenic diet, Johns Hopkins University Medical School, the ketogenic diet, we notice all of these risks drop enormously. Think healthy fat diet, high fat diet. The authorities are now saying diet needs to be 50 to 70%. 50 to 70% fat calorically in your diet. That's not 10%. Think about it. The brain is 60, 65% fat by weight. How can you replace and repair your brain on a low-fat diet? You can't.